Hello, I'm Julie Duncan-Miller and I'm one of the researchers on the IMPETUS project. Watch the video here for a little bit about supported self-management, the backstory to the project and what we plan to achieve with IMPETUS. The Go On Yourself self-management strategy for Scotland defines supported self-management as a person-centred approach in which the individual is empowered and has ownership over the management of their life and condition. Everyone with a long-term condition should have access to supported self-management. Well, stroke is a long-term condition, and in stroke specifically, we have a commitment to supported self-management through the Stroke Improvement Plan. So supported self-management is an important concept. So let's be clear about what we mean about supported self-management. Well, supported self-management is not about replacing services or expecting people to do everything for themselves. It's not about the more traditional perceptions of education or stroke survivors complying with professionally driven treatment plans and goals, nor is it just focused on function and level of impairment. Instead, it's about supporting people to build the skills, behaviours, confidence and capacity to live well with their long-term condition. It's about listening to what matters to them, to people and their families to help them to self-manage their own way. There's now a growing acknowledgement that true person-centred self-management is a collaborative partnership between professionals and stroke survivors, where people should be firmly in the driving seat of their own self-management, deciding what works for them, how they want to be supported or facilitated to self-manage, and co-producing this support or personalised plan. A few years ago, we received funding from the Burdett Trust for Nursing to undertake the Talisman project. The Talisman project aimed to develop and evaluate a person-centred self-management intervention. Perhaps unsurprisingly, this work showed that for clinicians to successfully embed supported self-management in practice, it depends on a variety of factors. This includes the wider external context, such as policy or geography, the structure and culture of the organisation, the professional involved in delivering self-management support, including their skills, perceptions and values around supported self-management and stroke, as well as the complexity of the intervention or approach itself. With all of these different elements to consider, it's really no surprise that confusion exists about how clinicians can best deliver on the policy agenda around supported self-management in their practice. Coupled with these findings, we also had data from the Scottish Stroke Audit which showed patterns of variation in how supported self-management was implemented across health boards in Scotland. But what we don't know is why it wasn't working well in some areas and not in others. What is it that's going on here underneath all of that might be transferable across different geographical and organisational contexts in Scotland and then on to the wider UK context? And it's because of these unanswered questions that IMPETUS was born, and for which we've secured funding from the Stroke Association to undertake the research. The IMPETUS project is a realist evaluation which will explore what works for whom and why in supported self-management in stroke. In the project, we want to understand what are the components and outcomes of supported self-management in stroke and what's available across Scotland. What are the mechanisms by which supported self-management works, and what are the contexts that are conducive to triggering these mechanisms to produce successful outcomes. We also want to understand how teams understand, refer on to and implement supported self-management in local contexts. The IMPETUS project is being led by the University of Glasgow, with collaborators from Glasgow Caledonian University and Nottingham and Kingston St George's University, plus members of the Scottish Stroke Improvement Plan, as well as our patient and public involvement team of stroke survivors with lived experience of supported self-management, and the project will be conducted with project partners from 4 NHS Scotland sites. You can read more about our collaborators on our website. We hope that the results of the IMPETUS project will ensure equitable provision of supported self-management across Scotland, regardless of where people live, particularly in remote and rural areas. Some of the things that we'll be looking at is how do organisations and teams work together to create a safe space for learning and practising supported self-management. How do they work together to shape supported self-management as a flexible approach that can be adapted and tailored to different contexts and different ways of working, or even different types of patients? What should training and support for helping practitioners to build confidence and developing more nuanced skills to support collaborative self-management look like, and how do they work? To keep up to date with what's happening on IMPETUS, why don't you follow us on Twitter @ImpetusStroke. If you've got any questions or you'd like to get in touch with a comment, Here are our Twitter and email details. We'd love to hear from you. Thanks for listening.